It can be really difficult to stick to New Year's resolutions, even at the best of times, but during these uncertain COVID-19 times, it can be even trickier. But it's just as important, if not more, to maintain those health goals now. So try and hold on to that light at the end of the tunnel. Remember to choose goals that are realistic so that it removes that anxiety of trying to reach impossible goals. Also, know what success means to you so that you know when you've reached that target and when you can reward yourself. We all try and eliminate volatility and doubt in our lives, but with COVID-19 there is so much uncertainty and that can be causing some anxiety. However, there is merit in accepting uncertainty. Every day we deal with uncertainty, every day when we cross the road, we deal with the uncertainty that a car may not stop to let us pass. But we accept that uncertainty and we still go out and we still cross those roads. And in that same way, we may need to accept that there is a certain level of uncertainty surrounding COVID-19. In accepting it, it can often dampen down that anxious noise and allow you to focus on things that are going on currently. It can also really help to focus on the things that you can control rather than ruminating over the things that you can't. And that's where a practice like mindfulness really comes into play. It combines breathing techniques and acceptance of uncertainty and observing that uncertainty but letting it go. Now, it can be hard for people who've never practiced mindfulness to know what to do, and that's where things like audiobooks, websites, apps can really help guide you through it. All this excessive worry can impede your ability to sleep, and it's recommended that adults have around 7 to 8 hours of sleep every night. Now, those that regularly have less than that can be at increased risk of certain health conditions, both physical and mental. So in order to ensure that your sleep is as optimal as it can be, do follow sleep hygiene methods. Now that includes things like avoiding caffeine, making sure that you're not exposed to too much white or blue light before bed. So that's the kind of stuff that comes off your phone, your laptops, your iPads. But also making sure you have relaxation time, maybe a warm bath just before bed. There are plenty of different techniques out there, so do try and follow some if you are struggling with your sleep. If you do think your moods are starting to struggle, don't forget the power of socialisation. We know that those who are socially isolated have higher risks of depression, dementia, and even higher mortality rates. We also know that socialising increases your hormones of oxytocin and serotonin. So both of these chemicals help give you that little mood boost. I know it can be difficult if we're in lockdown situation to stay in contact with friends, but don't forget that technology is on our side. So pick up your phone or do a FaceTime and make sure that you're still having that kind of connection with friends, family, with a therapist, with your GP. Don't forget to talk. For some, it's not as easy as just seeing friends again to boost their mental health. Many people are finding it very challenging to get out there into the community again, having been sheltered for so long. It can be very normal to feel anxious about it, having been cocooned in lockdown for so long, even if you don't have a diagnosable mental health condition like agoraphobia. But if it is starting to affect your everyday life, don't forget the importance of reaching out to a healthcare professional.